productivity enhancements and better performance contributed to significant growth in our economy and great advancements in the delivery of services in all kinds of ways, in the private sector and in other parts of government. In social services, however, we felt like the time was going past, that there were advancements and improvements in helping people and businesses, but social services was not getting those benefits. And that's why I'm very happy that my colleague at 𝐬𝐥𝐢, 𝐬𝐥𝐢, decided to put together this event and bring to the attention of people in Washington and around the country how we can make technology more effective in helping struggling Americans. We're going to get three pretty solid presentations by our guests, including one by Kevin, and then we're going to have a panel discussion afterwards. And I'm going to quickly introduce the three panelists, and then they'll go one right after the other. So first up will be Andrew Stettner, who is a senior fellow at the Century Foundation, previously at the National Employment Law Project. He spearheaded a decade-long effort to realign the unemployment insurance safety net with the needs of the modern workforce that culminated with a multi-billion-dollar package of reforms enacted in the Recovery Act of 2009. After working at NELP, he took his research on low take-up of social insurance into action, designing and implementing the multi-million-dollar benefits enrollment and also holds an MPP from Georgetown University. He will talk about benefit access and how technology can enhance benefit access for low-income Americans. Next up will be Derek Khanna, who is a Silicon Valley-based lawyer who's been referred to by Business Week as an advocate for startups that don't exist. Mr. Khanna led a national campaign that resulted in legislation being enacted in 2014 to legalize consumers unlocking their cell phones, one of the latest technology bills enacted into law. He was previously a House and Senate staffer with experience on Governor Mitt Romney's 2008 and 2012 presidential campaigns, and he will be talking about the gig economy and how it can better help low-income Americans. He told me before that he was looking forward to speaking because it's been one of his dreams to speak at 𝐬𝐥𝐢. We're really glad to have you here, Derek. Thank you. And then finally, our colleague here at 𝐬𝐥𝐢, Kevin Corinth, who is a research fellow in economic policy here at 𝐬𝐥𝐢, where he focuses on homelessness and poverty. Kevin has studied the effectiveness of homelessness policies, the treatment of shared housing arrangements and safety net programs, the role of community and economical rental housing, and ways of improving social services through competition and technology. Before joining 𝐬𝐥𝐢, Dr. Corinth was a lecturer at the University of Chicago. He's also worked on research analyst with Analysis Group in Boston. He has a bachelor's degree in economics and a political science from Boston College, and a master's degree and a doctorate in economics from the University of Chicago. I have to say it has been a great pleasure to work with Kevin these past 3 years at 𝐬𝐥𝐢. He brings not only great depth of knowledge and commitment, but tremendous heart, and it was his inspiration that brought this event together, and we're really glad, Kevin, that you did it. I have one other housekeeping announcement. We're going to have, at the end of the three presentations, we're going to then go over there, and I will moderate a panel discussion in which we'll have questions from the audience as well as from our online attendees. And I just want to let them know that if they want to ask a question, they go online to sli.do and enter the code 𝐬𝐥𝐢 event, one word, 𝐬𝐥𝐢 event. And that will allow you to ask a question, which I will see on this little, it's very non-technology to me to call it gizmo. But that's what I'll call it anyway. And then I'll have the question, and I'll ask that as well. So
there's 45.7 million Americans living in poverty, including nearly 12 million children. And that's after you count government benefits and tax credits. And without the safety net, those numbers would be much worse. 9 million families are lifted out of poverty by refundable tax credits, 4 million families by SNAP, or known most as food stamps, and 3 million families by supplemental security income for the disabled. And most importantly, we have learned a lot in the last 10 to 20 years about the impact of the safety net for kids in particular. Rigorous research finds that refundable tax credits, which are about $2,500 per family, reduce the incidence of low birth weight, kids have higher test scores in elementary and middle school, and those kids are more likely to graduate from high school and complete one or more year of college. The expansion of Medicaid in the late 80s and early 90s resulted in fewer high school dropouts, higher college attendance rates, and a more likely chance of attaining a college degree. And food stamp benefits, when are available to pregnant women, produce a 23% lower incidence of maternal low birth weight, and an increase in test scores for elementary school kids. So there's actually a large agreement, I would say, here in Washington that refundable tax credits, nutrition assistance, and healthcare are a good investment in low-income families. But we have a problem, is that these major programs are governed by completely different rules, overseen by different committees in Congress and different federal agencies. And that's not to mention smaller benefits like energy assistance. So historically, for clients, that's led to a very splintered system. Multiple agencies at the local level would ask the same individuals the same set of questions about their situation, and most services were delivered in person. Even if at the same agency, the process of each benefit application would move separately. For visual, folders would move separately along a conveyor belt in an agency. And the large legacy computer systems, mostly built in the 70s in a language called COBOL, which only those of us who are old know about, would hamper any efforts to streamline the process. And even if individuals are able to get through that difficult process, frequently people would lose out of benefits because of just paperwork. You have to renew your eligibility at 3 months, 6 months, or 1 year intervals. And even if the person really is underlyingly eligible, if they don't provide the paperwork in a timely fashion, they could lose out on benefits. And this is called churn. And a 6-state study found that 17 to 28% of people on food stamps suffer from churn. So I got involved in this work first, as Robert referred to, in New York City after the 9/11 attack, when many people who are in need had never needed anything before and really didn't know how to navigate the system. And when I started working with Single Stop, we found it was not just a New York problem. We commissioned McKinsey to do a study that found that there were about $65 billion in benefits and tax credits each year that went unclaimed by individuals that were eligible for them. And only about 7% of people were receiving all 4 major benefits at once: tax credits, Medicaid, food stamps, and child care. And it was a problem that was really screaming out for a technological answer. We figured out first that we needed a new way to reach people outside of government offices. And then if we could find a piece of simple technology, put them in the hands of people in neighborhoods where people live, at the union, at the church, at a settlement house, and just people that know how to talk to people and ask them basic questions about themselves, we could cut through that confusion. Then computer programmers could come in and do what they do, which is to create rules engines, simplify hundreds of pages of rules in each different program, and find a way to create algorithms that would simply tell you, based on who you are, what you're eligible for, and could eliminate or limit the number of trips that people would have to go to the quote-unquote welfare office. So this created a tremendous amount of private intervention. First, with numerous desktop programs. A mathematic study 2 years ago found hundreds of what we call benefit calculators, and more recently, mobile apps that help individuals find out what they're eligible for, with names like Single Stop, Benefits Bank, Benefits Data Trust, Benefits Kitchen, and 𝐬𝐥𝐢. So, and these private innovators, they can not just bring different government agencies together, they can use nudges and prompts to help people get through the process. So this volunteer group, Code for America, built an app called 𝐬𝐥𝐢. When you first apply for it in that app by just asking 4 questions to start an application, and then you send you text messages reminding you about all the other things you have to do to follow up to get that benefit. The trick is that many of these privately developed apps by private developers or nonprofits could tell people what they're eligible for, but with a few exceptions, they couldn't actually process the application because it's government that ultimately files the application. So imagine if you could go to Amazon, find out what you want, but you couldn't actually buy it. So there were, the barrier was actually, in fact, not always technology, but rather the will of government to open up their systems to the private and nonprofit sector. So there are very legitimate privacy concerns that got in the way there, and I think those are growing rather than diminishing, but there's a lot that we can do to move that. Government can expose all of these rules in ways that programmers can simply program. They can create what are called secure APIs. That's ways that different healthcare agencies already communicate and talk with each other every day. That could be transferred to social services. The thing about this is fixing this is really a bipartisan issue. Certainly there's people that care about poverty, that want to connect people to a greater share of benefits. But it's also about doing it more efficiently. Opening up a new case, we talked about churn a little while ago, costs $80 per client. This is a study in South Carolina. It costs $80 more per client than recertifying. So if we can keep people on benefits without getting knocked off and file a new application, then the states save money. And by using data rather than paper, we're going to do things more accurately. External data sources about someone's, we were just talking about this over lunch, external data sources about someone's social security number are going to be more accurate than what an individual provides themselves. So this has really taken off, as Robert said, a little bit slower than other parts of the economy, but it has really started taking off. Government agencies themselves, kind of copying some of the private innovations, have created portals for applying for benefits. And in some of them now you're starting to look at your own safety net benefits with an account. You can see where every application is, what you have to do to maintain your benefits. The goal is really the low-income people accessing the safety net should have the same experience that you and I have every day when we look up our credit card balance, our bank account, figure out what we want to shop for. Online, and states have built, now 30 states have built SNAP applications as of 2011, and that was up from just 11 states in 2005. States are building what are called integrated eligibility systems, so creating one system that helps process all the benefits that they are responsible for processing. And the kind of next step is they're creating their own internal data architecture. So there's one place in each county or state where all the information about each client is stored. And when that person needs a different type of service, they can securely get the information about what other services that they are receiving, other information about their identity, their background. So they not only do they not have to fill out the same application, but the people that are helping them with one service would know what other services that they're getting. These improvements came as a result of knocking down some bureaucratic rules here in Washington, particularly one that if someone like Robert wanted to build a new program for his different benefits, he had to ask for reimbursement separately for the part that was for food stamps, the part that was for Medicaid, the part that was for TANF, which is very hard if you're just building one front page. That rule was changed, and now the federal government is paying for 90% of the cost for states of rebuilding their systems. And just in some survey, just one company alone, Deloitte, that I know well, has installed these integrated eligibility systems in 22 states. 2/3 of states now have integrated eligibility systems, and this is making a difference. Utah increased the number of people each caseworker could help get benefits on the basis of having better technology by 53%. So how do we go further? The crucial thing is to go further in the sharing of data. What do I mean? Government already has lots of the data that someone who's in need of a safety net benefit needs to provide in order to get benefits. So healthcare reform has really paved the way. Now there's something called the Federal Data Hub. It takes in one place data from the IRS, unemployment insurance from private credit reporting agencies, Homeland Security, that allows someone applying for help from the marketplace or Medicaid can establish their identity, their citizenship, and estimate their income. When I first started work, this is what we would see people with Ziploc bags with all their documents that they really had to carry from one office to another, often with unstable housing. That data now can be all in one electronic place. There are states now using what are something called express lane eligibility, which is key, enrolling people in one benefit when they're already established who they are and how much they're earning and whether they're eligible for another benefit. So kids in Louisiana that are on food stamps are automatically put on health care, and they're mailed a card from the state of Louisiana, and as soon as they use it, they accept that benefit. Now we're that problem of churning, which is a huge problem. We are using 34 states are using what are called ex parte renewals for benefits. That's when, if the state already knows how much income you are earning when they send you a letter, when they were supposed to send you a letter to certify it, they'll automatically certify you for continuing to get access to health insurance. And the idea really, we should go for automatic renewals of help when the government's able to establish that the person is indeed eligible. So my caution after doing this work for a number of years is that technology alone won't solve the problem. Many individuals still need the human touch to understand concepts or get tripped up. And although government online systems are a lot better than they were, often they're still in their infancy replicating what was a long paper applications. They still may have hundreds of questions that someone has to fill out who may not have access to their own computer or a good internet connection. So we have some research about this, that if you can mobilize voluntary or very low-cost community-based organizations, you can help people navigate through this process. Consumers were twice as likely to enroll in health insurance if they got help from a community navigator than if they applied on their own in the first years of the healthcare reform. We're using call center approaches to reach out to more vulnerable populations like the elderly. A group called Benefits Data Trusts use data to target exactly the senior citizens who are on very low income, and they know that because they're getting Medicaid, to help them access food stamps. And we know that helps to reduce the cost of the healthcare system because seniors that have proper nutrition are much less likely to need hospitalizations. So we're making a difference, but we still have a long way to go in this area. The percent of individuals that are eligible for food stamps that are receiving it, something that we've tracked very carefully, has grown from 50% in 2000, kind of in the wake of welfare reform when things were really changing, up to 83% last year. 91% of kids that are eligible for health insurance receive benefits, but there's still a lot of room to grow. In fact, still 20% of individuals who are eligible for the Earned Income Tax Credit don't receive it every year based on the IRS estimates. And of all the people that are uninsured today, 43% of them could actually access health insurance either through Medicaid or the marketplace. And some states still pay food stamps to barely half of the individuals that are eligible. Some small states like Wyoming and big states like California. So that's a little benefits. I'm just going to say, if I have a little time, a few more words about services. So data sharing can do a lot for better targeting services. Right now, as a result of the evidence-based policy movement, we are doing a much better job at identifying those services that can move poor people closer to self-sufficiency, whether it's career pathways or sector-based training, nurse home visitation, assistance to college students, but we don't get the right clients to those services. And for all the money that's produced in the federal and local government, government does not provide a complete searchable list of services that are funded. But the private sector, again, is stepping in. Aunt Bertha was started by an individual who actually worked for the state, but it was helping his mother deal with cancer, and how it went, and found it was incredibly hard to navigate, even just finding the basic services that she needed. So they created a searchable database of services that are meant to replicate someone's Aunt Bertha, who really knows where everything is in town. And is now being used by health systems across the country to get their patients the services they need to recover after being in the hospital and stay healthy, saving them money and the government money in costly readmissions in the hospital. So these efforts could really go to scale pretty simply. if the government were to create a single architecture of how to name and characterize services, and every time someone got a grant from a government, they would have to use this architecture, submit it to a database, say who was eligible. Then you open that up in the same way that Google has opened up their Maps API, and people will build apps and programs around it, to build around it. So where do we go with this, long term? 21st century government should be making accessing services easier and benefits easier by sharing their data. When you work with government, a lot of what they do when you want to share data is they just say no, because that's their reflex, because there are laws that protect privacy. But there are some jurisdictions that are taking an open data mindset. And when someone wants to share data, they take the approach of, we want to say yes. And there's still a lot of work to do here. Half of states surveyed say the federal data sharing rules are unclear, despite tremendous guidance that has been put out on the issue. Half of states still only share data with other agencies when required by law, and less than a quarter have some central repository data that makes this work possible. We're still far away from what we used to talk about here when I did this work in Maryland, from a no wrong door approach. If you are interested in health insurance, tax credits, food assistance, you should at that time when you're applying find out about what you're eligible for, at the very least, and have the opportunity to apply for it once you give your information. Most action is now at the state level. The federal government has given a lot of room for the states, but there are some federal policy changes. That federal data hub that I mentioned is only available for health insurance. So we're trying to make that same federal data hub available for other benefits, especially it's that IRS and Social Security data which they guard very carefully. And we're really only scratching the surface of the power of social media and text messaging to reach low-income communities. If people on safety net programs started interacting with their phones around benefits and assistance, the same way they interact with it around friends or shopping, it could really become a hub of activity. Apps could help push people reminders about all aspects, not just of their benefits, but information about other services at other times of the year that could help them based on their profile and what they're revealing about themselves through social media. We can use phones to help people manage their budget, manage their health, and mobile. And my real thing is that the private sector, mobile web, and app developers could really take the lead in developing this if they have the access to the information they need to develop apps and technology. Thank you so much.
All right, let's see if this, there we go, that works. Great, well, very excited to be here. As was mentioned originally, it's always been a dream of mine to be able to, I guess it's over here, to be able to speak at American Enterprise Institute, and it's a real honor to be able to speak at the brand new office of American Enterprise Institute. And so what I want to talk to you guys about today is what I like to call Workfare 2.0. I also wrote an article about it called Uber for Welfare, and an article in Aspen Institute with 𝐀𝐄𝐈𝐄𝐧𝐭 delving into these issues. What I came to the conclusion was that our federal entitlement systems were really built for a different era. Even the most recent one, arguably TANF, is now really showing signs of disrepair in light of the 21st century economy. And so what I'm trying to do here is to show how can we bring these entitlement systems designed in a different century into the 21st century? How can we leverage the benefits of the modern economy and recognize that the assumptions that we made are now out of date? Specifically in the context of what I call Workfare 2.0. Specifically, how can we leverage the gig economy to re-engineer these systems? Okay, my argument is that the government should expect that able-bodied individuals, I guess I made a typo there, that able-bodied individuals be willing to engage in the gig economy before receiving benefits. Note that I'm saying able-bodied individuals. I'm not saying everybody across the board. But the expectation should be that you're willing to work in the economy for whatever jobs exist. And to do so, that requires that policymakers rethink the entire safety net, impacting nearly every federal entitlement program so that it's compatible with the emerging gig economy. Every federal entitlement program, of course, not including Social Security for old age. But that's no easy task. There are some important decisions that we need to make to move in that direction. So first of all, defining what the term workfare is. Many people in this room probably know what workfare is. It's a simple idea that we should be requiring people who receive government benefits to be working or giving back in some capacity. And about 83% of American adults favor workfare. About 7% are opposed to workfare. But in the past 15 years in particular, I guess past 20 years, that's really changed quite significantly. I guess a lot's on this slide. But the first part, so TANF in the 1990s, Bill Clinton signed into law workfare, requiring individuals to being willing to work in the local economy in order to receive government benefits. That was a big part of 𝐬𝐥𝐢's contract with America. But over time, those requirements have been eroded. And today, universal work requirements are essentially a vestige of a bygone era. In particular, the Obama administration issued a memorandum that it would issue waivers exempting state governments from the work requirements in the '96 law. As part of the economic stimulus, food stamps were given, states were given abilities to waive the requirements for food stamps. Now, to some extent, some of this has started to come back online, but the fundamental idea that these programs should require workfare has generally eroded, which is a little bit ironic because when these laws were created, the systems for workfare, in my opinion, weren't truly online, but actually the gig economy makes workfare easier. So at a time where the economy has actually shifted to make workfare easier, the law has actually changed to make workfare antiquated or no longer required. So delving a little bit into individual entitlements. So Social Security Disability Insurance is a huge entitlement program, $210 billion. It has no work requirements. Now, why does it have no work requirements? Because this is for persons who are considered to be disabled. That makes sense until you go under the surface a little bit. And in particular, we can see that this program is really ballooning drastically out of its original projections. As the population's grown by 20%, the recipients have grown by 50%. I should also mention that people who are on SSDI, they also receive Medicare benefits regardless of their age after about 2 years. There's also another program called Supplemental Security Income, which is a $65 billion annual program. And that's designed for people who haven't been working, also who are considered to be disabled. And I'm going to delve a little bit into what I see as the problem here. There's been a lot of literature, particularly out of AEI, about how this program has become abused. Some have argued that this is essentially where the welfare recipients from the 90s have shifted to. So why did we never implement real workfare in the 1990s and today? So the idea of workfare was premised upon being able to find jobs for the individuals who receive benefits for Medicaid or for unemployment insurance, et cetera. And there's been a real lack of leadership necessary to properly implement this system. Federal policy in particular isn't really well structured to foster the work requirements. There's a lot of administrative challenges. So if you're a local state or a municipality and you have people on unemployment insurance, are you supposed to call up your local Wendy's and say, I have 20 people here who would like to work, would you like to hire them? And there's kind of a false dichotomy, which is that you're either able to work or you're not able to work, or you're unemployed or you are employed. I don't think that was ever accurate, but it's certainly not accurate today. In addition, there are several other issues as far as a lack of flexibility. Many of the people who receive government benefits are raising children or taking care of aging parents. This is particularly true among single mothers, which is often more difficult for them to maintain a 9-to-5 traditional type job, or more expensive. The child care costs may be more expensive than the amount of money that they'd be earning by having a job. My argument is that the gig economy actually addresses many of these issues. Now, why do I say that? Because in the 1990s, you were either working at a Wendy's or you weren't working at a Wendy's. You either had a job in the morning and you came home in the afternoon or evening, or you didn't, for the most part. That's not what the modern economy looks like. You could be, after this presentation, I could turn on my phone and be an Uber driver for the next 4 hours. That didn't exist in the 1990s. It wasn't possible. So jobs today are much more flexible, particularly in the gig economy. You can work whatever hours you want in almost any location that you want, and you can generally, can find jobs that are above minimum wage in the case of Uber and Lyft. These jobs can be entry-level positions for someone without a degree. It doesn't require a government administrator. There's no regulator that I'm calling up for permission to work for Uber. It just happens. And these can be full-time or part-time around flexible schedules. Now, I want to talk about flexibility in particular because flexibility is very important for people who are receiving these government benefits. If you're trying to raise children, you may have some time, but you don't have all the time in the world for a 9 to 5. And in addition, if you're trying to get your feet back under you to work at a more traditional job, being able to have a flexible job is more useful to be able to continue interviewing for the professions that you're more interested in. So the gig economy is very useful to kind of be this interim step between having the job that you had before and being completely unemployed. It's a new middle ground between the two. Now I want to caution, I do mention here that the gig economy can be full-time. I don't believe that it's always a full-time replacement. Most Uber drivers are not full-time Uber drivers, for example. Most of them are doing it on the side. Most of them are doing it while looking for other jobs potentially. So why workfare? Why am I advocating for workfare? Well, the social science data is pretty clear that it's to the benefit of recipients to have to wake up on a daily basis and have a routine, to have to go to a job, that there's a benefit of that rigor, that you're working towards something, that you're applying towards something, that you're actually earning the money that you're bringing in to take care of your family. This literature is pretty robust. It's a psychological thing. It's also adding to your skill development. Workfare teaches important employment skills. Now, some people will say, well, what are these skills, right? If we're talking about lower level workfare, what are these actual skills? Well, you have to remember that for most of the population that's receiving unemployment insurance or welfare benefits or Medicaid, et cetera, that I'm going to delve into, these are populations who generally don't have a college degree. These are populations that generally are working in jobs that are not necessarily as advanced in the traditional sense. And so what are the skills that you're looking for as an employer before hiring somebody in these categories? Well, you want somebody who's going to show up to work on a daily basis. You want somebody who's going to be entrepreneurial to the extent that they are actually willing to put themselves out there without being required to do so on a daily basis. Are they going to clean the kitchen in the back without the boss explicitly telling them to clean the kitchen in the back? These are the type of life skills that an employer is looking for out of these less advanced employees. Well, if you're an Uber driver or a Lyft driver or you work for Postmates, you are relatively entrepreneurial. You have to tell yourself to get out there on a daily basis. No one is saying that you need to go out there and drive. You make yourself go out there and drive. You need to take care of your own vehicle. You need to have a level of customer care with the clients that come in your Uber vehicle or whatever it is that you're doing, because if you don't, you'll get fired as an Uber driver. So these are actually relevant indicators for an employer to say that you actually have demonstrable skills as opposed to just having a vacancy in your resume for 8-12 months. So any work is better than no work in signaling to an employer that an employee is low risk. So I talk a lot about Uber and Lyft drivers. They generally earn well above minimum wage. Anybody can be an Uber and Lyft driver in nearly all cities and suburbs. There's no interview process. You just install an app, submit your credentials. It's flexible in the schedule. And I'll deal with the car issue later. The reason why this is important is because the whole unemployment insurance system is built upon the government's going to give you a check, or the welfare system. The government's going to give you a check because you can't find a job. How does that exist in a world where everybody can find a job? And that's the world that we live in today. Aside from the most rural areas where Uber and Lyft don't operate in, or other gig economy companies don't operate in, there are jobs available for everybody. Now, these jobs may not be at the level that you wanted. They may not pay at a salary that you find to be particularly reasonable. But again, the underlying assumptions of unemployment insurance and welfare is that there aren't jobs. And so my goal is, how do we reconcile those two things? How do we take the benefits of the gig economy and kind of reboot these existing systems? And so the relevant question here is, well, what if somebody doesn't have a car? How can you be an Uber or Lyft driver? Well, actually, they've solved that. Uber offers Exchange. There's a third party called Breeze, and Lyft offers Express Drive. So all these will provide a car for you to engage in ride-sharing activities. And in Lyft's case, they even pay for your insurance and maintenance. Okay, so am I only talking about Uber and Lyft? Well, I'd have a very weak presentation if I was saying that my whole argument is on the basis of one or two companies, but I'm not. The gig economy is extremely broad. I could give a whole presentation for the next hour and a half on all the opportunities of the modern gig economy, and the list is getting longer. And many of these are, kind of delivery type models. The Postmates are working for Amazon or Instacart, or picking up laundry and dry cleaning, delivering flowers, assembling furniture, stuff like that. But these are jobs available in nearly every city in the United States, in most suburbs. And you can see at the bottom, 22 hours as a cleaner, $45 as a handyman. These are jobs that are paying more than minimum wage. Now, again, they're not necessarily a full-time replacement. I'm not saying they are, but this is a new interim step. The existing assumptions of the 1990s were you either had a job or you didn't have a job. These are all things in the middle. And I have more examples. So these are examples of people who generally don't have demonstrable traditional skills. These are examples of people who have specialized skills. If you're a photographer, you can offer photo shoots. Singers can offer voice lessons. And this is potentially virtual. It can be done at any place, anywhere in the world. And there's even more gig economy jobs. And what's changed is not that you didn't have babysitters. We've always had babysitters. We've always had people who would offer to take care of pets or house sit. What's changed is that the internet has allowed for a frictionless marketplace for buyer and seller to converge and for there to be essentially the law of one price, to have a reasonable market mechanism to pay back for that labor. And so you have a lot more liquidity within this marketplace. And so people who have specialized skills can monetize upon those specialized skills. If you're a graphic designer and you have layoffs at the company, you still are a graphic designer. And so you can be doing graphic design work online. We need to leverage these skills, because if you're an unemployed person and you can be doing graphic design work, maybe it's not 40 hours a week. Maybe it's not your old job at $50,000, but it's a lot better than just receiving a check from the government. Or it's a lot better than the government saying you should be working at this local Wendy's, because you're actually gaining new skills that are relevant to your future vocation. So I don't believe that the current safety net is compatible. The unemployment compensation system, food stamps, welfare, Social Security disability benefits are not built for this modern economy. These are extremely flexible, virtual locations, a large number of options. And so if I delve into these individually, unemployment compensation, the government's going to give you a check because there aren't available jobs. Well, there are available jobs. The idea of food stamps is generally to very poor communities, areas generally don't require work requirements anymore because those work requirements have been waived. And Social Security disability benefits are for people who are considered to be disabled. A 0 or 1 proposition. You are either able to work or you're disabled. I have 2 more minutes. All right, let me just jump through this. Okay, so the disability benefits example. I think this is really the one that's most ripe for disruption with the gig economy, because I don't believe in the idea that you're disabled or you're not disabled. And when we tell somebody, hey, you're disabled, you can't give back to society, I think it's a real slap in the face. Now, obviously, there are some people who are, per se, quadriplegics. They're probably not able to do very much. But if your disability is, I can't stand for 8 hours a day, that's not a disability. There are jobs for you in the modern economy where you don't have to stand for 8 hours a day. And in fact, that's what some people have claimed to receive disability benefits. And my argument is that with the gig economy, we can find new jobs for people that are relevant to their particular accessibility needs. And some scholars have argued that at one point in someone's life, everybody could legally be considered as disabled. And once you're on the disability rolls, you essentially don't get off. And there's a lot of variability within the system, a lot of subjectivity. So I'm kind of scared to work, because if I work, they'll go down on my check. This was from a This American Life episode. There are several other people who were interviewed who were saying that their main issue was they couldn't stand for 8 hours a day. Well, I got news for you. My grandparents couldn't stand for 8 hours a day in their 60s. I don't know many people who would want a job that required them to stand 8 hours a day in their elder age. But that's not what the modern economy looks like. There are lots of other jobs such that we don't have to just say, okay, you're disabled, you don't have to work for the rest of your life. That's not a very good way to go about solving the problem. Okay, So I guess I have about a minute left. So I have a 10-point plan to implement Workfare 2.0. I'm obviously not going to be able to delve with all of this. The first is we want to study what can be done within this modern gig economy. The second is we want a live updated gig economy directory. What do I mean by this? Most people don't know the available jobs in their local communities. Or if they have limited accessibility, I can't stand for 8 hours a day. What are the jobs in the gig economy that facilitate that? We need an updated gig economy directory, a public-private partnership to help facilitate that information. We need to redefine the definition of disabled because I don't believe that telling somebody that they can never work again because they can't stand for 8 hours makes very much sense. I think there's a lot more jobs that are available for these populations. We need to provide access to existing resources. So many jobs in the gig economy require having an internet connection, for example, or being online to whether it be babysitting or whatever else. And some people who are unemployed or work or on welfare don't have these type of programs. So we need to provide access to it where it exists, such as in libraries. We want as much innovation through devolution as possible. We want states to be able to try new ideas. And we need job retraining for people who may not have necessary skills in the new economy. So if I can just jump to the end here. As long as Uber and Lyft will hire anybody who can pass a background check, we can't just give out a free check to anyone who chooses not to work. And my solution is Workfare 2.0. Thank you.
All right, well, my name is Kevin Corinth. I'm a research fellow here at AEI. So I'd like to turn our discussion here this way. There we go. There we go. So I'd like to shift the discussion now to some of the poorest members of society, so the homeless individuals who sleep on our streets. And so at first it may seem weird to put technology along with homelessness. When we talk about people who are homeless, we're talking about people who are not able to meet some of their most basic needs, in particular shelter and housing. Also people who have a number of complicating issues, so people who more likely are suffering from severe mental illness, chronic addiction problems, disconnection from employment and family and community. And so why would we think about technology? Well, I'd argue that these are the precise reasons why we should be thinking about technology and innovation. The problems are so intractable and complicated and tough, and our current solutions aren't doing enough. So if there's any place where we need innovation, it's in this space of homelessness. Okay, so innovation to me requires three different things. First, you need to gather quality data, so you can't know if you're doing a better job on something or even monitor your progress if you aren't collecting the data you need. So that means tracking data on individuals over time. It means monitoring our progress and hopefully seeing what works. Number two is testing ideas, and that just doesn't mean trying different stuff, but it means trying things in a rigorous way. So using randomized controlled trials and the best methods in social science to figure out what the causal impacts are of different ideas and the things that we're already doing. And then number three, implement what works. You can collect all the data you want, you can run all the studies that you want, but if you're not willing to actually do what works, you're not going to be able to have any innovation. It'll be great for researchers like me, we can write lots of fancy papers, but we won't get things done for the people that we really care about. Okay, so why are we struggling on homelessness? Well, the problems are complicated, the problems are really tough and deep, but we don't have these conditions for innovation. I think that's what's really stalling us. So one, we lack quality data, and we have made some improvements in this area recently. We now do conduct counts of homeless people every winter. They are done by volunteers in ways that vary across time and space, so the reliability isn't always great, but we do have some counts. We can track people while they're in shelters. But we can't track people while they're at the most vulnerable, while they're actually sleeping on the streets. We can't track people while they're in housing and after they've actually have to use the services they've used and they've succeeded. And so if you can't track people while they're actually suffering the most and while they're actually most successful, you can't really figure out what's working. Number two, we lack a platform for testing ideas. And again, it's not that we don't try things. So one of the great things about our homelessness effort is that there's lots of variation in our response across localities, different local governments, lots of private money that goes into new approaches and bold thinking. The problem is that this usually leads to anecdotes and stories. So a particular nonprofit may try something really interesting and new. They find that this seems to work for some particular person. They tell their story, they raise money. But without that quantitative social science research, namely randomized control trials where you give some people the intervention randomly and some other group not the intervention and see what that causal impact is, that's the only way we're actually going to figure out what works so that we can expand these things to localities in the countrywide. Okay? And then 3, of course, we lack a means of doing what works. So again, we do have some innovation in the homelessness space. There has been some research for some populations in some areas with some service providers that shows some success. But what happens usually is then we get bureaucratic solutions that tend to be one-size-fits-all things legislated from the federal government. So in the homelessness space, this is currently something called Housing First, where you give people housing unconditionally, it gets them in the doors, but we haven't made progress in some of the other areas that are really important for people. Okay, and so we aren't able to continue that innovation and really get at the things that really matter, which is helping people fully improve their lives. Okay, so how do we address these 3 barriers and therefore get innovation? Well, smartphones, okay? And so smartphones can serve, I would argue, as a platform for innovation. So let me give you the 30-second idea. Here it goes. So give homeless people free smartphones and free service plans. That includes internet, data, internet/data, text, and voice. As a condition, they're required to provide data on where they're sleeping each night, their status, their connections with family and friends, and then use that data. So run randomized control trials, deliver things to smartphones like Uber credits or cash incentives for showing up at shelters or doing other positive things. And figure out what works and then finally implement those solutions that work, combining the best of research and policy implementation all into one. So I'll get into what all those things mean, but I fear that people are probably worried about using smartphones and homeless people in the same sentence. And so let me first quell one notion, which is that homeless people don't have phones. So first of all, many homeless people do have mobile phones. And this actually does include lots of so-called dumb phones. But increasingly, and these are even dated surveys now, but in 2012, 89% of homeless veterans surveyed had at least some kind of mobile phone. In a lot of cases, this is phones that are subsidized through the federal Lifeline program, aka the Obama phone, which is really a Reagan phone. I don't really like that meme, that YouTube video. If you know what I'm talking about, don't watch it. So anyway, but it shows that homeless people are able to hold on to a mobile phone and that they find some value out of it if they're willing to actually hold on to it. Also, even in that 2012 survey, 30% had a smartphone that they were using. I would venture to guess that in 2016 that maybe well over half of individuals sleeping on the streets have a smartphone. So this isn't something that's some crazy idea of giving smartphones to homeless people. Many already have them. Additionally, smartphones are actually pretty cheap. iPhones are expensive, Samsung Galaxy phones are expensive, but when it comes to sort of basic phones that have those functionalities that are economical, you're looking at price points below $100. So this is a drop in the bucket compared to what we're already spending on homelessness when it comes to emergency rooms and ambulances, homeless shelters, jails, and police enforcement. Okay, so now that we've allayed that concern at least partially, let's go to how would this work. Okay, so again, this is all founded on how do we get innovation in the homelessness sector, which I would argue, again, comes down to these 3 points: data collection, experimentation, and then actually doing the things that work. Okay, so data collection. So I imagine a smartphone app that would be created. People would be asked, using the smartphones that they receive or that they already have, to provide information on a daily or weekly basis, depending on the question, on what's going on. So where are they sleeping each night using GPS? Are they working? What kind of money are they making? Are they contacting friends and family? Are they using services? All the things we need to know to see whether our efforts are having an impact. Okay, so step 1 is providing that platform, but step 2 is, how do you get people to actually provide data? Do people actually have the incentive to provide you personal data on themselves? And so, one incentive here is a free service plan. So as part of this, you get free voice, text and internet plan, and that may be enough. For some people, they may require something more. Maybe some people have service plans, so you may want to experiment with other incentives. E-gift cards delivered through smartphones, maybe cash incentives through e-banking accounts, maybe even deliver every month cash through people through a courier who finds them through GPS. Okay, so there's ways I would imagine to get people to provide their data. I'm an economist, so I'm naive about things. I always think if you get the incentives right, you can drive the behavior. This is something you'd want to test in a pilot project in a particular city. What incentives do you need to get reliable data? Is it even possible? I don't fully know, but I suspect, again, maybe naively, that it would work. Okay, so data collection is one thing. We have all this great data. We can track individuals over time. The next question is, how do we figure out what actually works? So this is where experimentation comes in, and rigorous randomized control trials. So a randomized control trial says you give randomly assigned one set of people to a treatment group, one set of people to a control group. Treatment group A gets the intervention, so this may be Uber credits for a month. Group B doesn't. This allows you to see what effect that intervention has on outcomes that you care about. Okay, and so you can imagine testing lots of things, many interventions which could be sent directly through the smartphone, and then with data that we're already collecting through step one. Okay, so maybe you want to see if subsidized transportation that gets people to go visit family and friends, if that gets them to connect with services. You could think about, maybe this is the resource problem. Do you give people unconditional cash transfers? Does that help people, or does it make them actually make them worse off? Cash incentives, again, I like these types of ideas. People who are homeless are very poor, unfortunately, and they do know how to survive. I mean, they survive on the streets and get food and stay alive. So what effect would cash incentives to come indoors to shelter or other supportive housing programs or whatever it may be, and actually get them to induce that behavior and see what effects we have on other outcomes? We could see things like in-kind donations. Is it a good idea to give people tents or haircuts, whatever it may be, information about services, or even messages from relatives to encourage that family formation, okay? In addition to the interventions we could deliver through smartphones, you could also imagine experiments through traditional means with real service providers. You could imagine evaluating service providers on the outcomes they achieve, not just while people are at the program, but also when they leave and succeed through housing and other ways. Are they maintaining that progress? So we can make sure that we're sending people to the best programs and sending our money to the best programs as well. Okay, now this is the tricky, biggest vision part, doing what works. It's one thing to collect a lot of data. It's one thing to do a lot of important studies and randomized control trials and figure out what works. But how do we actually get those things implemented? So here's my vision, this homeless innovation center, as I call it. So if you think about innovative companies like Amazon or Uber, these companies are collecting data all the time on their customers. They're trying different things. They're randomly experimenting. And then when things work, they actually roll those things out for different people. They try different iterations, different variants, and then when those work, they expand them. So I think the same thing and the same mindset is needed on homelessness. So if we're having all this data coming in, what about this homeless innovation center run by data scientists, homelessness and addiction and mental health experts, homeless individuals themselves with lived experiences on the street, and they could develop this research agenda, right? And they would be determining what are the things that we could try that might actually get the outcomes that we want, all right? And so they get the data in real time. They can then craft particular interventions for different people, see what works for different types of people, and then expand on that and dynamically update research and policy together, all right? And this is sort of this magical utopian, yes, this is the way to unleash rapid innovation in the homelessness sector, all right? So this is my dream, say 10 years from now. What do we need to do now? We need to figure out if we can really collect data from people with smartphones. If we can get that accurate, reliable data on a regular basis, I think these possibilities are real and that we could transform our delivery of homeless services to the people who need it the most. Thank you.
So I hope my mic is working. Is that right? Okay, good. Now we get to have a discussion. And this was really a great kickoff from each of you. And I really appreciate the presentation. And in some way, we sort of went from, it's been done so much, it's almost mundane, benefit access, to the gig economy, a little twist on something, but it's out there, and we see how that could possibly work, to way, 10 years from now. And that's great, because that's what innovation and experimentation is about. So I'm going to ask a question for you and a question for you and a question for you, and then we'll see how that discussions go. So first question for you, Andrew, and I sort of have to ask this because you are at AEI, and we believe in self-sufficiency, and we're not big fans of dependency. And when I was listening to you, and I did what you talk about, I did it in New York City. I maximized benefit access using technology. I know how to do that. But what about real self-sufficiency? Is it really an avenue to increase dependency? Is all this benefit access a way of getting all the benefits to all the people as rapidly as possible and to increase government dependency?
So I think that, at least from my perspective, for the large part, the safety net has moved from a welfare safety net to a set of incentives for people to work. The economy, unfortunately, has grown in a way where there's a large growth in low-wage jobs and high-wage jobs. Many people cannot find income alone to even afford to rent a two-bedroom apartment. There's only a handful of major cities that a minimum wage job can allow you to afford to rent a two-bedroom apartment. So what most of these programs do is supplement work income. And then for those who are unable to work or temporarily unable to find work, there is a limited and basic safety net. And I think it's very important to think about the perspective of kids. Having a basic set of income enables kids to grow up in environments where they're not faced by toxic stress. And what we know now, which we didn't know before, was if kids don't have income at a very young age, there are physiological changes to their brain and other systems that they cannot recover from. And so I'm very moved by research-based interventions, some of them natural experiments. So people may know about these studies from Duke. When the Eastern Cherokee Indians in North Carolina built a casino, they decided that they would give the money to everyone in the tribe in the area. The fact is that the tribe members do not look that different than white or black families in the neighborhood. They're very integrated. And it was very, like the AITC is $2,000 to $3,000 a year. The kids in those families were less likely to have alcohol problems, more likely to graduate from high school, less likely to be incarcerated, less likely to have health problems. So these are, I think we need to move this concept from welfare dependency to what is the basic support that people need to be able to live healthy lives.
But just to follow up, to the extent that the ease of access created its own work disincentive. In other words, if you're able to get a package of benefits much easier than working those extra hours to get that income, you might choose the package of benefits. And so government is good at transactions, getting the transactions, but not so good at necessarily ensuring that there is work attachment as well. Is that right? Or, I mean, there is, you have to admit, there's a trade-off.
I think another way of looking at it may be that if we can make accessing is more of a way that someone like Abraham Maslow might have looked at it, a great psychologist. If people can address their basic needs, then they're more likely to think about being able to get a better job, go into a job training program. And I worked in this in community colleges. These are people that are trying to live the American dream and get a college education. Often have to drop out or stop out. In fact, half of students that start community colleges don't get any credential. When we're able to help address their basic needs by making it easier to access safety net programs, we're able to increase their semester retention by double digits. So I think the real sweet spot is here. We should be combining access to a basic floor income with job training, job placement, and other programs that help people to attain more self-sufficiency. And my point was, we know a lot better what works in that area. So now we don't have to put people into training programs that don't go anywhere.
Right. I want to come back and talk to you about the community colleges, because we have this great paper on an effort with Latino students and how to make sure they stay in community college and get the benefit of it, and how the benefit access programs can work in that regard. But Derek, I want to ask you about it. I was sort of struck by you saying there wasn't, or didn't seem to think there already was a connection between the welfare system and the gig economy. it occurs to me that the gig economy is perfect for that individual who wants to work just enough so that they don't lose eligibility for various benefit programs, don't have time necessarily because they're working in the gig economy to do the face-to-face interviews or show up on a daily basis to some program, but have enough time to apply and are technologically savvy. So I was just wondering, how do you react to that? What if the gig economy and its flexibility becomes a way for people to work part-time and maximize their benefit utilization?
I mean, that's exactly what I call for. I want people to be able to engage in the gig economy to the extent that those jobs are available. And if they don't make enough money to get by, that's when the safety net should kick in. And so it should be more like an earned income tax credit approach, where the more you're willing to put yourself out there, the more we're going to help you as a response. And so that's really a preferable outcome. But right now, that's not how the system works. And particularly in the case of SSDI, where the vast majority of people who are disabled want to work, which means that, they consider themselves able to work. But if they work more than a very small amount, a few $1,000s per year, they're no longer legally considered to be disabled. And that's essentially how many of the other entitlements work as well. And that doesn't make any sense.
I think you're absolutely right that in that particular area of programs, disability programs, this is ideal because the work disincentive is very strong. It's a flat rule. I've met with people all the time in New York City who said to me, I'd like to work. I'd like to work in a variety of ways that sort of line up with what you described, but I can't. I'm prevented to. And so I think that's a great place to go. I think with other programs, SNAP, Earned Income Tax Credit, there's a kind of alignment of purposes here. The gig economy allows for flexibility and part-time work, but these other programs provide that, shore up that gap between part-time work and
definitely. I mean, the idea.
But let me ask you this other question, and this goes to income verification. So we've talked a lot about the use of technology in maximizing benefits. Is there a way to maximize the agency's knowledge of the income received from work through the gig economy? Is there a difference in the way people in the gig economy are paid than W-2 or 10? I mean, they're not W-2 employees, right? They're 1099 employees. What is your knowledge about the way in which the government is interested in making sure we provide enough benefits, but not too many benefits, if work replaces the need for assistance? How does that work? Can you see how that could work?
That's a good question. And so most of these workers are 1099. That's kind of what the gig economy term actually means. But there are some companies that we consider to be sharing economy companies that actually have W-2 employees. But mainly it's 1099. At the same time, they have very detailed records of exactly when every Uber employee is working and how much money they made on that individual day. That allows for a lot of income verification. You know if somebody's working or if they're not working. It's documented.
So if the terms of receipt of assistance required income verification on a regular basis from the agency, the Uber economy could provide that.
Yes, and I'll add one other thing. The main argument against my proposal has been, well, what if there aren't enough jobs available? Which I think is a little bit of a silly idea personally. But you could actually have Uber or Lyft provide, this person was on the Uber or Lyft network and able to pick up patrons during these hours. They just weren't passengers during those hours. And so they were actually willing and able to engage in work. And so it actually allows a level of verification that's never existed before.
Well, I mean, I think what you're really saying is that given the availability of employment opportunities, work requirements are more likely to be successful because there are places for people to go. So Kevin, you know, big sort of morass in social policy, homelessness, street homelessness. We haven't made much progress. It's something we face in any major city in the United States every day. We see people walking to work who we wonder what's going on with them. Why are they there? And aren't there enough services in our city to provide for them? So why are they here, or are there not enough services? So my first question is, in the gathering of data, what do you think you'll learn about how, based on your other knowledge, on how street homeless people survive?
Yeah, so I mean, I think we do definitely have some data already, which can provide some indications about how people survive on the streets, but not nearly enough. A lot of it's based on anecdotes from police officers and nonprofit organizations, and these narratives that get built up over time about what it's like to be homeless. And so I don't think we really have the evidence that really says, what happens if you go clear an encampment of people sleeping on the streets? And I think that'd be really interesting to know, so that if we know we're going to be clearing encampments, which almost every city does, what effect will that have on the individual person? Does that drive them into shelter and get them into services, which is a good outcome? Or does it destabilize them further by disconnecting them from the caseworkers they already assigned to? And so whether services are available to people, I think it depends a lot. I mean, in places like Washington, D.C. and New York City, we do right to shelter laws, which actually do provide shelter to people. I think the problem is a lot of people don't want to go into shelter for a number of reasons. And even getting people into housing can be hard at times. And so I think there's a lot of really difficult problems there that if you had that really precise longitudinal data on people, you could figure out what it takes along each step of the way to get people into shelter and into housing and get them the help that they need, improving their lives more fully.
But just to follow up on what people are already accessing, the homeless person who agrees to participate in this and is going to derive the benefits that you're going to provide in various incentives and is going to provide the information we want, is it your envision that they would also allow the entity that's trying to learn about their situation to match their name and social security number against providers of assistance in programs like SSI or food stamps? So wouldn't we immediately know for each one of the participants, if they were to do it, do you envision that as well?
Yeah, so I mean, I think that's an important point, is that we want to match up any kind of smartphone collected data with administrative data that already exists. In part to verify, to make sure that the data that you're collecting is actually accurate, but also to use that administrative data in purposeful ways. And so, are people collecting SSI already, which is cash assistance? And is that actually a good thing or not? Are they being helped by that assistance in food stamps and different programs like that? So I think having the ability to match the self-reported data with that administrative data would be key to verifying the data and also going forward to improving these. I'm a bit skeptical in terms of actually getting the cooperation needed to do so. I mean, it's really hard when you have different service providers and shelters with their own kind of motives and sharing data across regions. So if people are moving from one city to another, are you able to get that data that you need to really follow that individual? And that's one problem and one reason why you do want to be able to follow people with a smartphone, which empowers them to provide the data on themselves and then to be able to track that person wherever they go.
So Andrew, a couple more for you or for the others. I just have you talked a lot about sharing data for the purpose of ensuring that recipients get all the benefits that they are entitled to. And that's clearly been done in various parts of the country, and they've also longer research periods, less documentation requirements, no face-to-face, phone interviews, all of which I'm familiar with and has led to a much greater participation rate in many of our safety net programs. And then at the very end, you talked a little bit about services, is that maybe we could do a better job of attaching people to things that aren't as easy to provide as a check or a benefit. And I wanted to ask you about that in the area of child welfare, for instance, where people can be identified as potentially being at risk of child abuse or neglect, or in the area of efforts to deter or detect or prevent fraud. In other words, matching against other data sources to reveal that, well, actually you are working, or actually you did have this benefit, or you're living with someone who has a certain income. Do you have any issue with any of that, and how much has that been done?
I think the fraud is an area where a lot has been done in terms of unemployment insurance or other programs to match whether people are working or not. I think in terms of targeting services, less has been done. I think in general, the barriers to sharing data have been hard even within agencies, especially when it comes into more sensitive areas like domestic violence or mental health. Agencies have been very limited, even in what they will allow their own caseworkers to see. I think we have to work harder with the proper privacy protections in place and the right kind of due process if someone for example loses eligibility. But we should be giving people who are helping others essentially more on their screens. This is stuff that's right there in the system, but they can't see it because they don't have the right training, and the general approach has been to be very conservative. And I think that's limiting, and we're very limited in what we do in terms of progressive pushing of information about services based on what we know about people. And we could do a lot more, in that area.
Can I add a comment to what Kevin
Yes,
was
go right
talking
ahead.
about? I think part of the brilliance of your smartphone model is that we really don't know what's going on the streets. And so let's say that you're a homeless person and you may ask, well, why don't they go to a shelter at night? Well, what if that homeless person went to a shelter and that shelter told him, oh, we're all full up. And he says, well, where are other shelters? And they say, well, that's not my job, I don't know. Is he going to go back to that same shelter and ask that every single night? Probably not. What if there's a shelter 2 blocks away or within walking distance? What if he's not told about that? So there's no real mechanism there. And it reminds me a little bit of the food bank situation, where years ago you would have one food bank that would be sitting on all this food and it would potentially spoil, or they'd have all this applesauce and they really wanted bread. And the reason was because you couldn't really buy or sell from these food banks because they were all nonprofits. They didn't really believe in the idea of buying and sell these goods that were donated. And then they created a market mechanism, which is essentially a new currency for food banks to buy and sell food wares. And so you can imagine similarly, homeless people having a smartphone and knowing all the shelters that have an available room in that particular night, and being able to give real feedback. Why did you sleep on the streets? And tell us why. Because right now we're basing our assumptions on how many beds to build based upon how many homeless people go to the shelter, which is based upon their understanding of how many beds exist. And so it's this feedback loop that's just not working.
I just want to make a couple of quick comments
Yeah.
on Derek's report. 'Cause I've looked at the gig economy, some of the things we're working at Century, and I certainly agree that it's expanding access to different types of employment. I would just make a couple of important comments, at least where we're at right now. Mm-hmm. So the best data is about 0.5% of all employment is through a platform. So I think, and many of the services and platforms that you're talking about are still really in their infancy. So I think it's very early to think about what the gig economy can do, for welfare programs. And the second thing I would just say that's really important, so we have a paper coming out about most programs, I think we could do a lot better on this, allow for some partial employment. So I think it's important for this audience to understand most social safety net programs are not zero work or zero benefits.
Yeah.
Most of them have a scheme by which you can pocket a certain amount, and then for every additional dollar you earn, you might lose that whole dollar, you might lose 50 cents of that dollar. Food stamps is that way, the tax credits are that way.
But not SSDI or SSA
so
or
then
the
there's,
biggest ones.
So there's certain, there's absolutely a lot we have to do, and a particular set of issues around helping people that are disabled get to employment, and I think it's a huge issue. But I just think it's really important to understand that, and if we could make those rules better, it would help incentivize people to be able to work more, and people want to be able to work more. I think there's a lot of work to be done to make those.
I completely agree, but that's what I was going to ask Derek. Is let's take the disabled population out for a second, because you're right. There's a lot of work to be done there, and that those programs need reform, and we've talked about that a lot. But in your presentation, there was a little bit of this workfare, self-sufficiency, get people. But if it turned out that a partnership between the social safety net work supports, SNAP, EITC, Medicaid, and the gig economy led to more people receiving those benefits because the gig economy allowed for this part-time work, would that trouble you?
Not necessarily. I think right now this idea that you're an unemployed person, you're receiving all these benefits, is not a good situation.
Well, but he's right. The fact of the matter is we support a lot of working people through the safety net program. The gig economy allows us an opportunity to possibly support more, and that may be okay. But I just I
just disagree with your supposition. I mean, the thresholds are so low. Substantial gainful activity in
EITC. People work in.
Well, as I mentioned, I didn't mention EITC for a reason.
Medicaid?
Because I think EITC is the program that we need to be emulating.
Yeah. Okay.
But the other programs, the thresholds are so low that if you're actually an Uber driver for a few hours a week, you're over the threshold. So these programs are frankly incompatible with the two.
All right. That'd be worth looking into, because SNAP, there are many people on SNAP who don't work. There are also some people on SNAP who are working some. So now, Kevin, coming back to you, that obvious question has to be asked of you. I'm sure somebody in the audience is thinking this. Is what makes you think that street homeless people will keep the phone, cooperate with the study, do all the things you're saying they're going to do, update their tell you where they ate and where they slept last night and what services they got?
Yeah, no, I mean, I think that is the fundamental question which drives everything else. And I'll tell you, honestly, I don't know if it'll work. I mean, my short answer is incentives. I mean, I am an economist, and so you'll think that I don't know what I'm talking about, but economists are very smart, I assure you. But homeless people, again, are very poor, and they do respond to incentives. So they do go to soup kitchens. They know where the soup kitchens are. They do find food. They find places to sleep that are horrible, but there's still places where they won't get harassed.
They choose good places to panhandle.
And
that's honestly true.
Yeah.
I mean, they have a sense of where they're more likely to receive benefits from people who provide assistance on the street. There are rational actors. Is that what you're saying?
In some ways, at least, and at least to the extent, and maybe in somewhat different ways than other people respond. But I think that these cash incentives, cash is really important to people, and so are, say, gift cards to go to McDonald's or something. That's important, and I think that if you get the incentives right, you have a chance here. And I'm sure there'll be people who will not participate no matter what. They've been burned by services, and that's one reason why they may already be out on the streets. But I think that there's a good chance that it could work. And given that more and more people do have smartphones who are sleeping on the streets, given that the cost is low, which mitigates the risks of selling them, and if they're lost and it's not too hard to replace them, I think there's real potential. And I think as time goes on, as smartphones become more and more normalized, and as data sharing becomes more and more normalized, that this has a bigger chance. But for all that reason, I want to do a pilot study in one city, 300 smartphones, give them out, see if you can get those incentives right, and get that reliable data, matching it up to the administrative data to see if it's accurate. And if you get that, which is a big if, then the other stuff could work, and the gains are so big where I do think it's worth that risk.
And just to be clear, you're looking for a partner.
Yeah, so I mean, I do think this would be interesting to do. I mean, if you have $1 million and you kind of want to fund something like this with huge risk, but huge upside, and
on our most difficult problem.
And just help the human beings who are literally, dying on our streets. And when they get into housing, some are dying there too because of overdoses, and they're not getting recovery from mental illness and connecting back with family. And so I think those things are the most important, and these are the most needy people. And so we need to try big, bold ideas that sound crazy at first, but may have a chance to succeed as the future envelops us.
I certainly, as someone coming from New York City who struggled very, very mightily with the homeless issue, we've tried an awful lot of things, and it's been hard to find success. So it's worth trying something even as far-fetched as yours.
Thank you.
And I meant that seriously and positively. So just to remind our online participants, you can send them in a question by going to sli.do and entering the code AEI event, one word, and you can submit a question, and I'll see it on this device here. Before I open up to questions from the audience, I did want to compliment you, Andrew, on addressing other comments by the panelists, and I want to offer any one of you any further comments on what someone else has said before we go to the questions from the audience.
Unless you want me to, I'm very open to
You're open
hearing
to
questions.
Okay, all right. Let's see, do we have any questions? Yes, sir, right here in the front. Right there. Mike is there. Thank you. And we'll go to the back next.
Hello, my name is Pedro. I'm from 𝐬𝐥𝐢 Institute, and thank you for the excellent lecture. So my question is addressed to Andrew. Kevin, sorry. My question is, what would be the criteria to choose who individuals would receive these smartphones? Because if you consider there are some homeless people who stay like 2 years in the streets, and also there are other homeless people who stay 1 month only because of some singular problems. So do you have any idea about it?
Yeah, no, so I mean, that's a really important question. Homelessness is a temporary condition. For some people, it lasts days. For the majority of people, it doesn't last more than a couple months. And for some people, it does last a long time. So this would target people who have already been homeless for some significant amount of time, who have potentially some other really tough conditions. I guess if you really just want to end homelessness and reduce the population, I don't think this is quite the idea for you. But if you see homelessness more as a signal as well that other things kind of have gone wrong and there's other deeper needs that people have, I'm not quite as concerned about getting the exact homeless population at any point in time. And so people would keep these smartphones after they've gone into housing or whatever it may be, and so they're no longer homeless, but I'd still want to be able to follow them to make sure I know what's working for those people. And so it's an idea which I think it's a really important point, and you could imagine, giving anyone at risk of homelessness a smartphone and then tracking entries into and out of homelessness would be what you need to do to get, what is the effect of different interventions on homeless population sizes. But if what you care about is essentially the human beings and what the underlying issues are, then I think this idea does have a lot more merit.
Way in the back.
Yes, good afternoon. My name is Todd Wiggins. I have a quick question, but before I do, I'd like to share a very quick story for you that's very relevant to what you're talking about, that I experienced at the beginning of the Obama administration, approximately 7 years ago. There is a soup kitchen called Miriam's Kitchen, and I'm a journalist, and so I was privy to an interesting experience when Michelle Obama came by, and she volunteered to work behind the line serving food. And so you can imagine 7 years ago, technology hadn't developed as far as smartphones is concerned, and it was a big deal if you had a phone that had a camera on it.
Yeah.
So this person comes up to the line. He's being served some interesting dish that Michelle Obama was giving out. She's the first person in line. He pulls out his mobile flip phone with the camera on it, proceeds to take a picture, and she poses for it. Now, again, that's 7 years ago, and that was a big deal. So in the YouTube video, someone reacted to that, and they said, well, why does a homeless person have a video camera? Because at that time, apparently, it was more rare. But now, as you pointed out, practically everyone has it. They're so cheap, you can get them at $40 or less, these days. So my question, though, is it seems as though no matter what our technology is, that it's always going to be either used or misused. So at what point, no matter what we give people, we can't control what they're going to do with it. At some point, it sounds like it's inevitable we'll be getting into trying to modify their behavior from their home experiences and so on. How far are we going to go before we get to that point where we really have run out of options to the point where we consider that?
I mean, personally,
Go ahead, Kevin.
I mean, I say never. The problems are extremely intractable, and they seem to be, but I would say we haven't had this platform for real innovation, say, in homelessness. And so I would say I would never want to give up on people, because everyone does have inherent value, and everyone deserves our best effort to actually help them thrive. And so technology is getting better. Maybe it will be misused at first. Maybe these smartphones will all get sold and it won't work at all. But I think, with more effort, as technology gets better in new ways that we could apply it, maybe in some way that will work. And then we will find get that platform together and then be able to experiment in different ways. And maybe there are some small interventions that work wonders. And if we just have enough, we try enough things and we let them play out, and maybe it'll work. But I'm an optimist, I guess, at heart, so we'll see.
Yes, sir. The checkered shirt.
Thanks. So my question goes to Andrew, and it's sort of in response to what was originally asked to you, where your program could, in a way, foster a cycle of dependency. But I was wondering, sort of on the other side of that coin, if your program would provide or make it easier to provide benefits to people, like full benefits that they're legally entitled to. Could allowing people to receive their benefits in full actually serve more as a platform for them to then go and find a job, instead of a situation where they're not receiving full benefits and they're even more entrenched in a cycle of poverty? I think it's probably important to note that even receiving full benefits, it's not like these individuals are living lavishly. maybe helping them receive full benefits could then actually give them a baseline of security to then go and find a job, as opposed to fostering dependency.
So, and the best programs I worked at, our rigorous evidence-based programs, would combine access to resources with other strategies. So a good example are people coming out of prison. So in the Social Innovation Fund funded program, Center for Employment Opportunities, very effective 1 week intensive program, puts people to work immediately after that in subsidized employment, and has been shown to reduce recidivism and help lead to long-term employment. The first thing they do is they put people through single stop, because no, people are not going to be able to succeed in a program like that if they don't have enough to eat, if they don't have health care, to take care of themselves, if they don't have a free cell phone, which you can pretty much, everyone can get now once you're on food stamps. You can't get a smartphone, but you can get a cell phone that can give you a decent amount of texts and voice if you're on food stamps. So if you don't have the basic things, you're not going to be able to succeed at their program. So I think that's what we should have more. We should have more programs that are connected well between the safety net, and employment. And I think in the example of SNAP, food stamps, a lot of efforts right now in all kinds of different jurisdictions to make the employment and training program stronger. I guess the biggest thing is I think it's hard to require someone to work in order to get benefits if you're not giving them either the help they need to find a job or access to a subsidized job. And so I think if you're not doing that, then that becomes the hard bargain. But if you're giving people the help that they need to get those things, I think it's a fair bargain.
It's also a little harder if you're not seeing them in the office. If the relationship between the government assistance provider and the recipient is all on the internet or on the phone, the case management aspects are more difficult. It doesn't mean they can't be done, but they make it a little more difficult.
Yeah, I mean, I think, but in some ways you could use data better. I'm working on employment insurance, so now you have models. We've had actually these laws in the 90s, and they're just being revived. Well, you can model what kind of person is going to not find a job, right?
Or model child welfare cases.
And just call those people in. Don't make everyone go up to the window every week to get their check, as we used to do in the 70s. But in fact, just call those people in that we know because they're older, because they got laid off from a manufacturing job, because they don't have they don't have more than a high school degree. We know they're more likely to be long-term unemployed. Just call those people in. Hopefully, it makes it more efficient. You can use government resources to help the people that need the help and won't find a job on their own.
Just to follow up on that, also is the net fiscal impact on the administration of benefit programs. Clearly, and you mentioned, I think you cited a few statistics with regard to efficiency for the caseworker, but there's also the added cost of the increased benefit amounts and increased participation. Some conservatives have it in their mind that the social benefit programs are huge bureaucracies. If we could just eliminate all those bureaucracies of state and local workers, we would make a significant dent on the cost of the benefit programs. Do you think that's true?
I mean, I think the way it's played out, it depends where you're sitting, right? If you were where you're sitting in the state, the benefits, most of the benefits are fully federally paid. So what you're concerned about, what you're controlling is your state and what your costs are. In terms of the net, the benefits, dwarf, the amount of administrative costs. But I think the goal is to target those people that are in need. And I think both in terms of, I think there's a lot of gains that we're just seeing in terms of accuracy of benefits that we can use, data effectively for. And I think we could go a lot further. It's just anytime paper form, it's really easy for people to make mistakes. Much better if you could use data.
Any other questions? Okay. Yes, right here. You have. I have another question too, but I'll let this lady go first.
Thank you very much, especially for your kindness. First, I really like this topic because I know our society problem is all in vicious cycle. from the beginning, those people who receive the benefit, they don't really like to receive the benefit. They would rather have employment. Then you have a homeless, but they say you have to build affordable housing, but they don't really affordable, and they have a home, but they were kicked out. And then you have food service.
Do I need
you
a
have
question?
everything.
You need a
My
question?
question, yes, is just vicious cycle. How come they are unemployed? How come they don't like shelters? And how come they don't have food to eat? They have to go to the park to ask for and begging for money.
Okay.
So all this, if we don't have a real solution, just say a project after another, it's not going to work.
Kevin, you want to?
Yeah, no, I mean, I think you're right. This is a very complex set of issues that people who are homeless often do face a number of obstacles. They aren't able to get employment. They may, housing is extremely expensive in cities, and even if they get into housing, how do you keep them there? And so I think those are some really tough problems with different solutions on housing. I mean, you know, removing regulations, I think, is one solution. But on the homelessness side, I guess, I think the really important thing is what are the things that will work? And so having that platform for getting at some of those intractable issues, I think, is really what you need at the end of the day.
So we began by saying that the technology revolution may have gone by or got ahead of the social services system. I think we learned today that actually, in some respects, the social services system has tried to catch up. We are more efficient at benefit delivery. Progress has been made. More progress could still be made. And we have a great opportunity in the gig economy and with smartphones and homelessness. So I want everyone to thank our panelists, and thank you very much.